So this has been a joint effort. So I'm going to thank a bunch of people because this is truly something that came together just over the last couple of weeks. Very, very quickly for a lot of people who have been focused on these issues for a very long time. We're talking today about extreme heat. We're in the middle of dealing with it, obviously. July will go down on record as the hottest month on Earth ever. That's just going to continue, folks. With global warming, it's not going to get any better. It's just going to continue to be a challenge. So it's going to have to be incumbent upon us to make sure that we are facing that challenge head on and proactively and as much as we possibly can. So I want to thank Dr. Sunil Joshi, our Chief Health Officer, for really just attacking this whole idea of creating heat centers, cooling centers, really, not heat centers, but cooling centers for the heat with absolute gusto. I want to thank Chief Keith Powers from the Jacksonville Fire and Rescue Department, Chief Andre Ayub of the COJ Emergency Preparedness Division. Andre, thank you. There you are. I should have looked over to see if everybody's there. Tim Rogers, our Director of Public Libraries. I want to thank Jessica Shepler, Chief of Government Affairs for the Jacksonville Transportation Authority, the Jacksonville Sheriff's Office. I think Chief Ellis Burns is with us. Christian Smith from the Red Cross, Michaeline Holland from the Red Cross, Major Keith Biggers from the Salvation Army and National Weather Service, Angie Inyeti. I want to thank all of you for being here, and I want to thank also Council President Ron Salem for taking the time to come over and offer his support for this program. It's incredibly important what we're doing today, and I think it's going to go a long way towards keeping people safer. So we know that extreme heat poses serious and immediate long-term health effects. That's why it was very important to gather all these folks here today for our city's heat task force. The task force has developed a response plan for the next time extreme heat hits our city, and I think we define extreme heat for those days in which the heat index rises to 110 degrees or above. And if you've been following lately, you notice that we've had several of those in recent days. In fact, one was expected today. I don't know if we've quite made it there yet, but this is becoming quite a common occurrence. So it was really important to get this effort together and to get this going. So everybody here today is going to work together to activate this plan. And I'd like to, before I go any further with anything else, and I'll take questions later, I'd like to invite Dr. Joshi over to talk to you about how exactly this plan is going to work. Please welcome Sunil Joshi, your Chief Health Officer.
Thank you, Mayor Deegan, for bringing us all together to do this very important work. Before we start, I do want all of our collaborating team up here with us because this is truly a collaboration. So Chief Powers, Chief Ayub, our folks from the JTA, the public libraries, Red Cross, Salvation Army, the Jack's Ready group. Am I leaving anybody out? Department of Health. Anyone who's been part of this process, please come up here because we have all worked on this together. This is not something that we do in silos anymore. The city of Jacksonville will work together so that we can always have a collaborative approach. And so one of the big things here that we deal with in Northeast Florida is heat. I mean, we're used to heat. And heat has been an inconvenience for us for a long time, but that's no longer the case. This is truly health-related emergency. This is not something that we expect to deal with on a regular basis and do nothing about. And so thanks to the mayor's leadership, we have come up with a collaborative plan to make an impact here in Northeast Florida. So heat affects our vulnerable communities. So whether that is the youngest people or the oldest people here in Northeast Florida, people with chronic health illnesses such as heart disease, diabetes, mental health related issues, and even lung issues, chronic lung diseases. There's plenty of data to suggest that people with these 4 conditions in particular end up in the emergency room or hospital during the summer months. And that's the case here this year as well. But we also have a very vulnerable community out there, a socially vulnerable community that is our homeless and socioeconomically deprived communities, folks that don't have housing and don't have air conditioning. And we have to figure out a way to take care of them as well. And so to give you just a little bit of perspective as we're doing research in this, The CDC tracks data based on different parts of the country in terms of people going to the emergency room for heat-related illnesses. And during the last week of July 16th through the 23rd, in the year 2021, there was an average of about 170 heat-related illnesses per 100,000 visits to the emergency room. This year, 2023, there was 406. Okay, so we're 2.5 times where we were just 2 years ago with people going to the emergency room using our healthcare system for heat-related illnesses. So something had to be done. And so we brought the groups together and we decided that we needed to come up with a way to protect our most vulnerable community. And as the mayor just said earlier, the National Weather Service, who I don't know if they're here today, but I would like for them to be up here as well. But National Weather Service has been, come on up, guys, come on up. Oh, great. Thank you so much. Thank you so much for everything you have done to help us understand what heat-related illnesses are and when you're going to give us a warning and an advisory. So basically, when there's a heat warning out there, a heat advisory, you're looking at temperatures in which the heat index is 108 to 112 degrees. And when that happens for 3 consecutive days, on the 3rd day, we will trigger phase 3, which Chief Powers will talk about in a second. Or if we have one day where we're over 113 degrees with the heat index, we will trigger phase 3 as well. And so I'm going to let Chief Powers and Chief Ayub give you the details of exactly what we're doing. Just as a general overview, I'll let you know that we did look at the most vulnerable parts of the community, and there are 6 areas we identified for these cooling centers. One will be in the urban core, one on the north side, one on the northwest quadrant, one in Arlington, one at the beaches, and one on the west side. And I'll let them give you more details on that. Chief Powers.
Good afternoon, Mayor. Thank you for putting this together. So there's 3 phases to this plan. Phase 1 is when the National Weather Service highlights the potential for a heat advisory or excessive heat conditions during their daily briefing or when they do their official NWS Jacksonville forecast. And what that's going to trigger is the Emergency Preparedness Division will reach out to our stakeholders and give them a daily situation report. They will also distribute protective action information via Jax Ready, which is our social media platform that we use in the Emergency Preparedness Division, and the notification of the Excessive Heat Task Force Command and General Staff, just to let them know that we're potentially looking at some activation later on. We move to phase 2. This is a heat alert, and this is when the NWS issues a heat advisory when they expect the temperature to exceed 108 to 112, the way it feels like temperature. And that will again trigger spot reports go into our key stakeholders from the Emergency Preparedness Division. It will also trigger Jax Ready to distribute out to the citizens protective action information. And it will notify the Excessive Heat Task Force Command and General Staff to prepare to activate the cooling centers. Then we move to the final phase is phase 3, and this is a heat emergency. And that's when we expect the temperature, the feels like temperature, to be between 108 and 112 degrees Fahrenheit for 3 consecutive days, or it exceeds 113 degrees for 1 day. And what that will do is we will activate our staff and cooling centers. Those cooling centers will be located at 6 areas of town, which I'll talk about in just a second. And we will also have JTA cooling buses that can augment COJ facilities when, if they're closed or if we need additional space. So phase 3, when it gets activated, the way the locations that you see were selected were determined using the social vulnerability index. And that is calculated using variables that include socioeconomic status, education, housing, infrastructure, age, race, ethnicity, transportation access, language barriers, healthcare access, and individual disabilities. Those locations will be open from 12 p.m. to 6 p.m. Monday through Saturday on days when heat emergencies have occurred in Duval County. So when we go to phase 3, that's when these facilities will be open. There'll be one located at the Legend Center, which is at 5130 Sutel Drive. The Highlands Regional Library, which is at 1826 Dunn Avenue. The University Park Library, which is at 3435 University Park Boulevard North. the main library right downtown at 303 North Laura Street, the Beaches Library at 600 3rd Street, and the Charles Webb West Gwinnett Regional Library, which is at 6887 103rd Street. And again, on the days that we activate those cooling centers, they'll be open from 12 p.m. to 6 p.m., which is the hottest parts of the day, Monday through Saturday. On Sundays, there will be JTA cooling buses located at the Legend Center and at the main library downtown to provide that coverage on Sundays if we go in activation of phase 3. So those phase 3 facilities will be staffed by one person from the facility themselves. There'll be a volunteer from either the Red Cross or the Salvation Army, and should that not be available, JFRD personnel will supplement that, and then JSO will provide security. JTA, who is a great partner of ours in the Emergency Preparedness Division, has also offered to provide complimentary rides to anyone seeking transportation to one of those cooling centers on the following routes when we activate into phase 3. So if you need to go to the Legend Center, routes 3, 4, and 22 will be the bus stop that you go to. If you're going to Highlands Regional Library, go to 1B or 3. If you're going to the University Park Library, go to 19 or 50A. If you're going to the main library, use 1, 3, or the Skyway. The Beaches Library will be 10B, and the Charles Webb West Gwinnett Regional Library will be 13, 16, 30, and 53. In addition, and I'm going to emphasize this word I'm fixing to say, in addition, if you are an existing customer of JTA's Connection, which is the paratransit portion of their service, or you're a Senior Star ID 65 plus member, you can also call and retain these services to transport you to a cooling center. What we said today when we briefed council on this, if you're bedridden but you don't have any signs and symptoms of a heat illness, but your AC is not working and you need some help, call 911. JFRD will respond and we'll do a wellness check and evaluate the situation and figure out a solution for you, because these centers do not have the ability to deal with bedridden persons. So we'll find you somewhere else to get you cooled off. And lastly, let me remind everyone that do not go to the cooling centers if you're experiencing any of the following symptoms: cramps, headache, nausea, fatigue, dizziness, or lightheadedness. If you're experiencing any of that, call 911 and let JFRD come transport you to a hospital. And with that, I'll turn it over to our Division Chief of Emergency Preparedness, Andre Ayub.
Good afternoon, Mayor. Thank you for having us here today and your leadership with this task force. So I'll be brief. I want to talk about the collaboration. I know Mayor Deegan mentioned it, but this collaboration, you see the partners behind me. I guess about 2 weeks ago, Dr. Josie, we met with my team and we started talking about this, and within 2 weeks, we put this awesome plan together. I can't speak, how awesome this collaboration is. I did not hear no one time. All these partners, when we talked about doing this, doing that on weekends, how can we help? How can we help? So it brings me so much pride, 28 years in government, to have all these partners agree on a common mission was incredible. Communication. As you see this board, we actually have not opened, I just want to make sure there's no confusion, we have not opened any shelters, but we have a robust communication plan. We want to make sure once we go to, as Chief Powers said, phase 3, well, all phases, to be honest with you, we have a robust communication plan to make sure every segment of this community, every citizen gets that information. So I'm confident with the plan. I'm excited to be part of it. Thank you, Mayor.
And we'll take questions from the audience and the mayors up here.
Number one, why Sunday do you cut hours on Sunday? Just staffing?
Well, you probably figured that most people aren't working outside on Sundays for the most part. It's probably not as big a day of folks working outside. But beyond that, I don't know why the decision was made. Anybody want to?
So those facilities are closed on Sundays, but we didn't want to leave a day out without those resources. So we reached out to our partners with JTA. So now we have those cooling buses for those locations.
When can we expect these to open? They're not open yet.
They'll be open during the times that we've discussed. So they'll be open based on circumstances. And then, of course, we're going to count on you guys to help us get the word out whenever that happens. We'll put an alert out, and then we'll let people know that those stations will all be open. So that's going to require a collaborative effort with you guys as well. When the heat reaches to that point, then we'll alert you. And obviously at Jack's Ready, we'll have all that information. There's going to be information on the Jack's Ready app on the website. So jacksready.com or jacksready.org. You can go there and get that information all the time.
Can you explain what exactly is going to go on inside of the cooling center? I mean, are there going to be beverages available, or is it just a matter of having AC on?
Well, it's a matter of having AC, but also water. I mean, the biggest thing when you have people who are overheated is that you have to hydrate them. So that's the biggest thing with the cooling centers, is to provide people an opportunity to get out of the heat, which primarily is going to end up helping their situation, and then make sure they get hydrated. Dr. Joshi, I'm happy to let you answer any more about that.
And luckily, with the help of our partners, the Salvation Army is going to help provide us with water, but the libraries themselves have water filling stations to begin with. So we have facilities for restrooms, we have facilities for water already available. That's why using these particular facilities is good for us. It becomes very cost neutral, and it also allows us to provide these cooling areas for the citizens who need them.
There's some discussion about the demographics, the types of people who may utilize this service. I mean, can you sort of give me an example of like a situation somebody might be in where this would be of a benefit?
Well, I mean, I think anybody who finds themselves in an emergent situation when it comes to the heat, if you're outside and you don't have a place of respite to go to that is cool, you can go to one of these cooling centers. It's pretty much that simple. There's not going to be, there are not going to be, there's not going to be anybody out there checking your, where you live, what you do, or anything like that. It's really about making sure that people don't find themselves in emergent situations when it's hot outside. I suspect that a lot of this is going to be people who are either outside workers or folks who are in a situation where perhaps they don't have AC. Those sorts of situations where the heat gets so excessive that one can get dehydrated or too hot quickly.
Any tips for people that own pets like dogs and typically keep them outside in the backyard? Do you suggest at this time to put them inside the house, or is there a number, a level that it would be appropriate to take them inside?
Yeah, I don't know that this plan at all addresses pets.
It doesn't, but obviously common sense is common sense. So as we talk about keeping people cool, we also want to keep our pets cool as well. So keep our pets indoors this time of the year. Just like when it's freezing outside, this is the time of the year to keep the pets inside.
We went through some of these heat emergencies last week or the week before, 3 days in a row. What happened then? I mean, did we see, you gave those figures from, I think those were national figures, weren't they?
Those are figures from the southeastern United States, yes.
What did we see happen here that brought this about?
Well, first of all, what brought this about was the concern about our homeless and vulnerable population in particular, the people who are outside and can't get shelter to begin with. And as you guys know, we do have a housing rental crisis here in Northeast Florida, so there's more of those folks and people who can't afford air conditioning as well. So all of this kind of came into the well-being of the community, which is what kind of brought us all together. But in terms of numbers in hospitals locally, it is really hard to track health-related illnesses because, as I was mentioning, people go to the hospital due to heat as a result of their heart disease or their lung disease or mental illness. And we've seen an uptick in people going to the emergency room over the last few weeks in general. How much of that is related to the heat or not is unclear, but those conditions that tend to get worse because of heat-related illnesses are the conditions that are showing up in the hospital or in the emergency room.
Kind of on those same lines in a way, because we've seen a big rise in domestic violence in the last 2 weeks.
Right.
Is that something too that's been related?
There is definitely data that suggests folks with mental health issues do worse with excessive heat. With excessive temperatures in general, so very, very cold weather or very, very hot weather, we do see an increase in psychoses, mood disorders, and people who commit homicides, suicides, and violent crime.
I'm not sure if somebody from the Weather Service can answer this, but do you have an idea of just how many times a year we may see something like this open, when we may see these kinds of conditions?
Yeah, absolutely. Hey, good afternoon. I'm Angie Agnetti from the National Weather Service office here in Jacksonville. So as was alluded to early in the briefing, the Weather Service provides two main types of products to alert of high heat indices. And we want to clarify the difference when we talk about, is it just extreme warm temperatures For us, what has been really oppressive, especially over the past month, has been the combination of the heat plus the high humidity, which creates this parameter called the heat index, which is, what it feels like to the human skin. So the two products to alert our communities from the Weather Service's end of high heat index potential are first the heat advisory, and we've heard what the definition of that is. It's when we're expecting heat indices of 108 to 112 degrees. And then the next tier up would be an excessive heat watch, or followed up by an excessive heat warning. And that's when we want to call attention to heat indices over 113 degrees. So just kind of going back in time here over the past 23 years, for our office, on average, we issue about 2 to 3 heat advisories annually. And in terms of the excessive heat warning watch product, kind of the higher end tier level, that's a more unique event. And we've only issued about 8 of those over the past 20 years here. So in terms of frequency, we're talking about climate change and the warming temperatures across the globe, as well as here in Jacksonville. That we're really excited that the administration, the Duval Emergency Response Team is understanding that, we're identifying these areas in our community that are more prone to this heat-related stress, but also coming up with plans on trying to how to mitigate those future stresses as well.
Well, look, we're doing everything that we can, and I know you've seen the plan as far as planting more trees. We're gonna take a lot of steps to make sure that those areas of town that tend to be 10 or 15 degrees hotter than other places in town have more mitigating circumstances, and that really means trees, providing more shade. So there really are factors that would allow the heat on the road or on the sidewalk to get to the point where it might provide somebody with an injury. So that's really what you're talking about in situations like that. But primarily, what we're trying to do here is simply to take steps to where either people don't find themselves in those situations at all because of things that we can do, or if they do have to find themselves in those situations, we have a place for them to go. Yes.
Mind if I ask an off-topic question? We've heard sort of an anecdotal report that it's been difficult to secure the permits to the new panhandling ordinance that was passed before you took office. Curious to know, do you have any idea of how many of those permits have been issued so far? Whether you're willing to look into it to make sure that those permits are going out, these organizations that use that means to collect money for whatever their cause may be are able to do so.
I don't know a thing about that right now. Do we have any information on that? We can try to find that out for you, Jake. Yeah.
Question for Angie.
Sure.
What are you anticipating this week? Here could be bad, but what's the weather service say?
Well, looking up into the future week, actually, let me go back a little bit and just kind of talk about where we've been in terms of this heat index parameter. This upcoming week, warm and humid. So, and heat indices are on, right now, based on our climatology over the past 30 years, we're kind of in the peak period of our daily high heat indices, which are around 102. That's average for the Jacksonville area, pretty much from late July through early August. So we are in that climatological peak right now. Looking forward to the next week, certainly heat indices around that 100 and 105 range. That's pretty typical for us here. What's been really unique, especially the past month, is that we've had about 32 days of our heat index being over 100 degrees, and in some cases over 105, and getting up into those heat advisory criteria and excessive heat warning criteria. But it is important, I think, for us to identify that we hear the saying it's not just the heat, it's the humidity too, and that's the real hazard. This elevated heat index that we're really trying to identify and mitigate human stresses for. So warm and humid this upcoming week.
So you won't see a need for the center probably this week?
Well, for instance, today we thought we might hit that number, and it doesn't look like we're going to. So I think, unless I'm wrong, I think that we had more clouds but bottom line is we won't know necessarily until we know. But the forecast certainly indicates that we can expect to have days that are closer to those ranges. So I think that's the thing. You don't know until you get there, but we can try to predict.
Are other cities doing this? Did you guys draw on any other kind of similar programs?
Well, I know that Miami has had cooling centers for a long time, areas where folks can go and get cooler. I know that that Dr. Joshi and the team just looked at what they thought would work best for Jacksonville. What are the areas that tend to get hottest? Who are the partnerships we can put together, and how close in proximity can we put those to folks that tend to be at risk? So there are other cities, as far as I know, that are doing the same thing. I know Miami, and I'm sure there are other cities in the Southeast and in the West that are doing the same thing.
Are pets allowed in the cooling centers?
I don't believe they are. Are pets allowed in the cooling centers? Yeah.
Has Jacksonville done cooling centers before?
I don't believe so. I don't believe as such they have done cooling centers before.
They haven't missed it.
Yes. Yes, that is going to be policy going forward. And there will be JSO representatives who are also at these cooling centers, so there will be security there as well. Yep. Okay, so I'm told that Downtown Vision and Changing Homelessness are going to help and get that information out. So I think it's going to be a group effort, like I said. I think you all will play a big part, and then we'll use every other resource that we have. Obviously, you can see that we've got a lot of community partners that are very motivated to solve this problem. So we'll be getting the word out.
There's mention of the routes that people can take to get to these. Is there maybe a place online where we could?
That'll be at Jack's Ready, won't it? Yeah, be on Jack's Ready.
That's part of
Yep.
our communication.
Yeah. Buddy?
Any limit to how long you can stay in one of these centers? I mean, we are catering to the homeless population here.
Well, you see they're open, you see their hours of operation. After that, those will be closed. They won't be open at night. Generally, the temperatures will drop enough at night to where it won't be as much of a factor.
And Mayor, part of that, the hours of operations, that's the hottest part of the day. That's why we open up during that time period.
Anybody else?
Any word with pools?
I'll get an update from Parks. I don't know at the moment. I was pretty focused on this today, but I'll take a look. You're now my pool reporter, so got it. Thank you, everybody, for coming. We appreciate it very much, and I'm sure that Dr. Joshi or any of these other folks would be happy to answer any questions you may have for them. Thank you.